Have you ever wondered how your body actually manages to route blood to literally one of its most complex, densely packed regions? Think about it. We're talking about an area that supports major organs, intricate reproductive systems, and the heavy muscles of our lower half, all while adapting to incredible, massive changes like pregnancy. How does this intricate plumbing system actually work without failing?
Well, welcome to today's explainer. If you are looking to master female pelvic anatomy arteries explained simply, you are in exactly the right place. We're going to map out the entire blood supply to the pelvis step by step. No overwhelming medical jargon, just the absolute essentials.
So think of the blood supply down there like a massive, intricate river delta. That large vessel descending right down the middle, that's the abdominal aorta. It's our main river. And as it travels down your abdomen, it has to branch out into highly specialized little streams to deliver oxygen and nutrients to very specific local environments. All right, let's dive into this. Right around the level of your fourth lumbar vertebra, or L4 for short, that main river, the abdominal aorta, splits into two. These are your left and right common iliac arteries. They travel diagonally down along the psoas major muscle until they hit the pelvic brim. And right there, at the sacroiliac joint, boom, the common iliac bifurcates again, splitting into external and internal paths.
Now let's trace that outer path first. You can think of the external iliac artery as an absolute express highway straight to your legs. It's a really large vessel. But interestingly enough, it mostly bypasses the pelvic organs completely. It travels right under the inguinal ligament, that thick fibrous band. And once it crosses that line, it actually changes its name to become the femoral artery, carrying the main blood supply all the way down your lower limb.
So the absolute crucial point you've got to remember here is this division of labor. It's like a dual transit system. The external iliac artery is your high-speed transit to the lower limbs, right? In contrast, the internal iliac artery acts as the local delivery network. It's the one responsible for diving deep into the pelvic cavity to supply the organs, the reproductive system, and the surrounding walls of the pelvis itself. But wait, before we completely leave that express highway, the external iliac artery actually does drop off two small local branches right before it exits the pelvis. The most notable one heads up to supply the abdominal wall. That's your inferior epigastric artery. But there's also a tiny little pubic branch that loops down toward the pubic bone.
Okay, here's where it gets fascinating and honestly a little dangerous. That tiny pubic branch we just talked about, it often connects, or anastomosis, with the obturator artery deeper in the pelvis. When this connection crosses over the superior pubic ramus, it forms what surgeons literally call the corona mortis, or the crown of death. It sounds intense, right? That's because it's highly variable, and if a surgeon doesn't realize it's there during a pelvic procedure, accidentally cutting it can cause severe, life-threatening hemorrhage.
All right, moving past that external highway, let's focus on the real star of the pelvic cavity, the internal iliac artery. It is a remarkably short, thick vessel. I mean, it's only about 1 to 4 centimeters long. It drops right over the pelvic brim and almost immediately splits into two distinct divisions to manage all its local deliveries, the posterior trunk and the anterior trunk.
To keep all this from getting overwhelming, let's tackle the posterior trunk first. This division is definitely the simpler of the two. It primarily supplies the wall structures of the pelvis and the muscles of the gluteal area. In fact, it only has 3 main branches: the iliolumbar artery, the lateral sacral arteries, and the superior gluteal artery.
You know what's truly fascinating about this posterior pathway, though? It's the superior gluteal artery. It is actually the largest branch of the entire internal iliac system. It exits the true pelvis through the greater sciatic foramen right above a muscle called the piriformis. And it has to be a massive vessel because it has the heavy job of supplying the large gluteal muscles that keep us upright and walking every single day.
Now, this next part is often misunderstood, but it is super important: the anterior trunk. This is the busy, bustling side of the network. The anterior trunk supplies the vital visceral organs. We're talking your bladder, your reproductive organs, and your rectum. The list of branches is a bit longer here: the umbilical, obturator, uterine, vaginal, middle rectal, internal pudendal, and inferior gluteal arteries. It sounds like a lot, I know, but we are going to trace the most vital ones together.
Just visualize how these dense anterior branches fan out across the pelvic cavity. It's like a crazy complex root system. They dive medially to wrap around the organs right in the center of the pelvis, while a few others sneak out the bottom to supply the perineum and the thigh.
So, the very first branch to pop off this anterior trunk is the umbilical artery. And man, this one has a seriously cool backstory. Before you were born, this was a massive artery carrying blood from you to the placenta. Once the umbilical cord is cut at birth, the part that travels up to your belly button actually closes off and becomes a fibrous cord. But the very first part of it stays open in adults. Its main job now? Dropping off branches to supply your urinary bladder.
Right next up, we can trace the obturator artery. It runs right along the side wall of the pelvis until it finds this little opening called the obturator canal. That's where it exits the pelvis to supply the muscles of your inner thigh. Oh, and remember that dangerous crown of death we talked about earlier? Yep, this is the artery that often forms that tricky connection with the pubic branch up near the abdominal wall.
Now we reach a truly specialized vessel, and this is where our river delta analogy really hits home, the uterine artery. Only found in females, this artery navigates right through the base of a structure called the broad ligament. It travels directly to the side of the uterus, and then it splits. You get an ascending branch that travels up toward the fallopian tubes and ovaries, and a descending branch that heads down toward the vagina.
But here is the thing. The uterine artery doesn't just stop at the surface. No way! It branches microscopically. First into arcuate arteries that encircle the uterus, which then dive deep to become radial arteries. These radial arteries finally end in spiral and basal arteries. And those spiral arteries? Absolutely crucial clinically. They supply the functional layer of the endometrium. They literally grow and shrink in response to estrogen and progesterone during the menstrual cycle, making them absolutely essential for supporting a pregnancy. Just below that whole system, we have the vaginal artery. This branch descends directly to supply the walls of the vagina and the base of the bladder. What's so beautiful about this biological design is the built-in redundancy. The vaginal artery forms these vital connecting loops, or anastomoses, with the descending branches of the uterine artery we just looked at. This ensures that even if blood flow fluctuates, the tissues stay perfectly oxygenated. Talk about a backup plan.
Finally, wrapping up the major anterior branches, we've got the middle rectal artery, which helps supply the lower bowel, and a really critical vessel called the internal pudendal artery. This one actually leaves the main pelvic cavity entirely, curves around a bone called the ischial spine, and enters the perineum below. It is the primary blood supply to the external genitalia, making it absolutely essential for sensory function and sexual response.
Okay, let's take a breath. To distill all this complex anatomy down, here are your 3 absolute key takeaways. First, the main plumbing splits at the common iliac. The external artery goes to the legs, while the internal artery handles the pelvis. Second, beware the corona mortis. That is a tricky, variable connection that surgeons absolutely must watch out for. And third, the internal iliac's anterior trunk is the heavy lifter for the reproductive system, branching into those highly specialized uterine and vaginal arteries.
And just like that, we've reached the end of our anatomical map. But before we go, I want to turn it over to you. Which part of the pelvic arterial system do you find the most confusing? Is it keeping track of those complex anterior branches? Or maybe visualizing exactly where the internal pudendal artery travels? Let us know down in the comments. And hey, if you found this explainer helpful, make sure to hit that subscribe button for more simple medical explanations. See you next time!